But oh, well, good evening. This is Senator David Carlucci. Want to thank everyone for joining us here tonight. The goal tonight is really to update you on what's happening in the community with all the changes that have happened with COVID-19. It's just one thing after the other. I just got back from Albany just a few days ago. We finished up the budget. It wasn't quite the budget that I had imagined when we started the session in January. However, I am proud of the fact that we were able to really put things together, hold the line on education, and make sure that we are reacting to the reality that we're in. A few days ago, probably a week ago now, I was talking to my friend Dr. William Greenhut from the emergency room at Nyack Hospital, and we just had a really fascinating conversation. Dr. Greenhut, who's with us tonight, he is on the front lines at the emergency room at Nyack Hospital, and he's just been telling me about what it's like there, and really the really difficult situation that our healthcare workers are in. And I thought it would be great. I know his time is so valuable always, but particularly now. And to have him join us is just really, we really appreciate it. So with that, because he's busy and on a limited time frame, I'll introduce Dr. William Greenhut, who is the Associate Director at the emergency room at Montefiore Nyack Hospital. And Dr. Greenhut, thanks for joining us tonight.
It's my pleasure. Thanks for having me.
So I know we were talking just a few days ago, and maybe you could just tell us what it's like there at the emergency room. What's been, obviously we know things are different, but how drastically different are they now dealing with COVID-19?
All right. So just truth be told, I did not work today. What I've been seeing is that, and you've probably heard on the news, that we might be reaching a plateau. But the past 2 weeks have been pretty awful, pretty much as awful as you've heard on the radio or seen on TV. Rockland County is a unique location, as we all are familiar. It's not like New York City. However, we've been busy, very busy. Our volume actually has been much lower than usual, our typical volume. But what we're seeing in the emergency department is probably of all of our patients, about 80 to 90% of them are suspected for having COVID. And our volume actually has been. Can you guys hear me okay?
I can hear you. Yeah, that was just some feedback. I was getting the iPad set up so I can read comments if they come in if we get questions. Okay. But yeah, please continue.
Yeah. There's no other term other than that this is a disaster. And fortunately, Montefiore Nyack Hospital was well prepared for a disaster. We're under great leadership from the administration, including the director of the emergency department, Dr. Jeff Raybridge, who's actually trained in disaster management. We were ready for this because we knew it was coming. We heard about it. We've been hearing about it since December, January, February. We knew the onslaught was coming. We were prepared. We had ensured that we had adequate PPE, that we had adequate staff and space. Now, the nature of the emergency department is that you're always on your toes ready for a crisis. But when you can prepare, that's really when it's the real test because you know what's coming. So I can say with confidence that we were prepared for this disaster. Doesn't mean it's been easy. It's been extremely stressful on our resources, on our emotions, and people have gotten sick, and I really feel terrible about that. I'm talking about staff. Yeah. But the message that I'd like to project, because it's true, is that we were ready for this disaster. We have been able to flex up to handle the demand. The passion of the staff has been unwavering. And I'm really proud to say that I work with fantastic people. I also appreciate the community and how they've responded to this disaster on behalf of supporting us in the hospital. We've seen a significant decline in what some would consider to be unnecessary visits to the emergency department. Now, I'm never going to judge a person to consider what's a true emergency. But people have been not coming unless they really needed to. The message is getting out there appropriately that what we're here for right now are real, true emergencies. And unfortunately, we're seeing a lot of that.
You know, we were
Now,
talking about yeah.
There's also,
Yeah.
I cannot speak enough about how wonderful our staff is. I work with amazing people, the nurses, the patient care associates, the other doctors, PAs, NPs, respiratory therapists, environmental personnel, security, facility, administration. I'm sure I'm forgetting very important people here, and of course EMS. We've all come together and battled this storm with courage and understanding and patience. I got to tell you, if anybody says that they're not scared by this, they're not telling you the truth. Because I know when I go into work, I'm terrified. I really am. There are colleagues of mine that don't work in our hospital, but throughout the country that are getting very sick, that some are dying. And we all go into this knowing that we could get sick. And I'm telling you that we're fueled by passion. We're fueled by an overwhelming sense of obligation to take care of our community because it's what we're here for. It's what we know how to do. It's what we want to do. And there's nothing is going to get us to work during a crisis like this other than an unwavering commitment. And I see that in everybody I work with, from the leadership all the way through the entire clinical staff and support staff. And I just wanted, whoever is watching, thank you. You're wonderful people. I'm so happy to be working with you, and our patients deserve your level of passion.
Well, that's so great to hear, especially from you on the inside, working shoulder to shoulder with all of these dedicated people. I know I've experienced that when I've gone to Nyack Hospital. When there's a problem, that's where we're going, and that's what I've always seen, and I've always been amazed how people really go above and beyond. It's not just a job; it's really a calling, and I think that is more true than ever. That now it's definitely not. I know at the hospital, it's never been about a paycheck, but particularly now in this crisis situation. So with that, I just wanted to bring everyone up to date with some of the numbers that we've been seeing. Today is April 6th, and we spoke a little over a week ago, and I remember how you were telling me how serious and dire the situation was then. But right now, we have over 130,000 positive cases in New York State, the largest in the nation. We have right here in Rockland County over 5,700 positive cases. In Westchester County, over 14,000 positive cases. And unfortunately, we've seen in New York State 4,758 deaths. So this is just, it's so hard when you read that number, and it sounds like a number, but you think 4,758, and we're not through this yet. And although there's been some positive news, over 13,000 people have been discharged from the hospital, and we see now approximately with the numbers we have, about 3% of the positive cases wind up in the ICU with around 4,500 cases in intensive care with ventilators. So the governor has now expanded the New York on Pause Act and the closing of our schools. Now it's expanded. It was from April 15th. Now it's till April 29th. And everyone would be in the same agreement that will probably continue on for some time. But as of now, we have the April 29th date. So that's what we know as of now. So school will be closed until then. And I think what Dr. Greenhut will begin to talk about is just the importance of social distancing and how we have seen some promising numbers in that. And that's why now is the time to stand strong and make sure that we are practicing social distancing and enforcing it across the board. And that's extremely important. We now know that the governor has passed the executive order to redistribute the ventilators and personal protective equipment. They call it the surge and flex idea, that constant communication with the hospitals and making sure that the resources are going to where they're needed. So that is just so important. So, Dr. Greenhut, I know you're going to talk a little bit about the importance of social distancing and what you've seen over the past few weeks on the front lines.
Okay. So what I want you to understand, and I'm not sure if people are getting it. I'm sure plenty are, but this is a nasty virus. Okay. A couple of months ago, we anticipated that this was going to be an upper respiratory tract infection that unfortunately hurt or killed older people. That is not what this is. We're all realizing this, and we're all still learning about it. Now, it's true, the vast majority of people, well, I wouldn't say the vast, about half of people, up to half of people may not really have any symptoms, okay? Doesn't mean you're not contagious, doesn't mean that you're not spreading the illness. But the vast majority of people will not ever need to go to the hospital and require treatment in the hospital. There are plenty of people that come to the emergency department for perfectly understandable reasons. They have chest discomfort, they're coughing, they're mildly short of breath. You are welcome to come to the emergency department if you have an emergency condition. However, I can tell you that we are discharging most people who come in with a complaint like that. There is a minority of patients, probably 14, 15% of patients, maybe closer to 20, that do require admission. Now, of those patients that require admission, the majority of those get oxygen treatment and some additional therapies and go home within a few days, up to 5 to 7 days, something like that. Then there's another portion of those patients that wind up on a ventilator. Now, I'm going to give you some, what we believe is concrete information right now, but we're all really learning still. This virus, as far as we know today, cannot be cured by a person. It cannot be cured by a pill. It cannot be cured by being put on a ventilator. The energy that we all must enforce and put into place is in terms of prevention. The Department of Health for Rockland County and New York State should be commended and applauded on their outreach efforts in terms of education and prevention. But it is not incumbent on these departments or your doctor or the hospital or a ventilator or pill to combat this illness. What we all need to do is strongly reinforce individual responsibility and following the guidelines as best as we can. Now, we're human. We're going to make mistakes. We're going to want to go outside because it's beautiful out. We're going to want to go to a park. We're going to want to see people. I get it. But what you may not understand is that if you transmit this illness to somebody even as young as 29 or younger, they could wind up in the hospital 7 to 10 days later, and rare case, but I've seen it, wind up on a ventilator. This is not an old person's illness. This is an every person's illness. That's true. Children, by and large, do not get sick from this, but it does not mean that they're not contagious, that they can transmit this illness to a grandparent who will wind up in the hospital and in serious condition. I want you all to understand that the recommendations by the CDC, Department of Health, is there for a reason. We need to do the best that we can as individuals to follow the social distancing recommendations. I would like everybody to assume that anybody that doesn't live in your home is potentially contagious. Now, that's not the true math, but you need to live by that paranoia, for lack of a better term.
I think that's the thing when we were talking about just over a week ago about how it doesn't matter. Someone could seem as healthy as could be, but they could still be contagious and spreading the disease. And that's why we talk about the covering your face when you're going out. It's not necessarily, it's really that you might be asymptomatic, that you might not be showing symptoms, but you might be spreading the virus. So this is why we now see that's coming in from more and more health professionals. What do you say about that, about the masks and covering your face?
Okay, well, there are people that also may have been mildly symptomatic and they thought they're in the clear. Just want you to understand the course of this illness, which varies from person to person, but The majority of people develop a high fever. They may have a cough, mild, moderate, and then recover. We see also people having headache and abdominal pain related complaints. There are people that come into the hospital after falling down and hurting themselves. We find out they have a fever, and it turns out that it's COVID-19. There are people that come in with all sorts of various complaints, and one thing that one time after another, they have a fever, their oxygen saturation is low. We check a chest X-ray, and they have COVID. And it is an imitator of lots of different illnesses. And I don't even want to get into what we don't know about it. But what we do know is that if you're sick right now, you may have it. So these numbers, about 1 to 2% of Rockland County may be carrying the infection. That's based on positive tests and reported illness. I imagine that number is significantly higher than 2%. It's our neighbors, it's ourselves. I'm not highlighting any particular person or group. It's everywhere. And what we have to do is not only practice social distancing, but we have to take it to the next level. You may have had a mild upper respiratory illness, think that you're better, but you're still contagious. Go out. When you go out, wear a mask. The CDC recommends that. You do not have to wear an N95 mask. We totally appreciate the community's involvement in funneling N95 masks to the hospital. You don't have to wear an N95 mask. You can wear a cloth mask. That's as advised by the CDC. Now, that will not protect you from an illness. That will protect others from your sneezing and coughing. If you are in an environment where somebody has the illness and you need to protect yourself, N95 is the bare minimum that you should be wearing.
So some things that have been coming up on Facebook Live, some of the questions about social gathering, and I know there was a lot of confusion that was going on in the county with the county executive saying he couldn't enforce the laws. And so the governor made it really clear that it's clear that our local law enforcement can enforce the social distancing, that they can enforce the Pause Act, and that now the fine has even been increased from $500 to $1,000. The reality is we hope that no one should be fined, that this is common sense, but I think it takes that level of enforcement in terms of even sometimes a police presence to get the point across of how serious this is. But I've been on the phone, we've been doing conference calls with the supervisors, the mayors, the police chiefs, and it sounds like, particularly here in Rockland and in Westchester, that we are in a good place where there is communication going on between the municipalities, that law enforcement is involved. I was talking to a village mayor today about him having to give a citation to a house that was being built, that there wasn't a reason for safety, or that it was a necessity. So he's like, this can hold out. You know, we've warned people, but now we're issuing the violations. So it's unfortunate that it would have to come to that, but I'm hopeful that there'll be some examples that are set so that people get the message. We saw right here, I live in New City and in the town of Clarkstown, and the town supervisor has now issued to close the town parks because of what we know now. This is so contagious that we have to really, really practice social distancing. And it doesn't matter the situation you're in. If you're closer than 6 feet, you can be spreading this horrible disease. And I think that's why it's so important to have you be able to communicate and share your story about how debilitating this is. And I know you were telling me stories about just how you see people of all ages and how it can just debilitate people and how deadly it can be. One question that came in I wanted to ask was about, we are talking about the field hospital in Rockland County to have more beds to be able to facilitate and take some of the pressure off Nyack Hospital and Good Samaritan Hospital. What do you think about a field hospital? Will that alleviate pressure particularly for Nyack Hospital?
Okay, I have a lot to say about that.
Yeah, please.
And I'll try not to be boring. So there are two things that I want to say. First of all, we'll take whatever help we can get. Our emergency department has been bursting at the seams. Fortunately, we were in a position that we had more room available. We just completed phase one of the emergency department, and that it basically expanded our size by 50%. Those rooms were prepared for standard emergency visits. Half of that new construction has been converted to an ICU. The second half has been converted to allowing admitted patients at least somewhere to be and not be in the main part of the emergency department. We have the ability to flex up even further by converting that other new section into another ICU, just in terms of beds. Additionally, we've turned 3 or 4 other areas of the hospital into ICUs. Beds are great, but it's not just beds, it's staff. I'm speaking, nobody authorized me to say this, but I will speak on behalf of the hospital that if you are a qualified and capable, trained individual, licensed or not, the hospital wants to hear from you to see if you can help staff these beds and do other things as well. I believe the email is hr@montefiorenyack.org, hr@montefiorenyack.org, because
And we'll
we
get
need
that
the
on
help.
our website as well.
And it's not just staff, it's the ventilators too. Now, as far as I know, we have not run out of ventilators. And we have been able to flex up in terms of space. We've been very tolerant of that. But are we still on an upward slope on that curve? We don't know that yet. And even if we're not, even if we're plateauing, we still need the space because the people that are being admitted today are not going home tomorrow necessarily. So we anticipate that we will still need more room, and we will gladly take whatever offloading we can get. We've been even hearing from the state and federal government that the new locations opening up in New York City and in Westchester are realistically going to be converted into beds for patients with COVID. It's not a relief valve because the majority of patients going into the hospital, vast majority of patients have COVID, and they look just like everybody else. I'm not trying to marginalize this population. I'm talking about in terms of their presentation. The presentation of COVID mirrors lots of things. I thought somebody had appendicitis. It was COVID. So these patients may wind up in, let's say, the Javits Center, and I just hope that they're ready and prepared to handle COVID in those locations because they're going to wind up there. Now, I have a master's in public health. I am not an epidemiologist. I don't speak on behalf of the Department of Health of any locality. But my firm belief is that law enforcement, just like a pill or a ventilator, is not going to solve this. This needs to be addressed at the primary location, which is at the individual. What we're seeing is a phenomenon, an outbreak that can be replicated in lots of different environments all over the world. What the Department of Health, I assume and hope, is doing is reaching out to local leaders of particular communities and penetrating the barriers related to culture, education, and language. It's true, many of the patients that come into the hospital, the majority are from families that are working a lot. There are sometimes many people in the same household, and if somebody has COVID in your household, you have about an 80% chance of transmitting it to another person. Some people are working more than one job or in a small office location or in other people's homes because they have to work. It's work or don't survive. And then there are other populations that are maybe getting misinformation from alternative sources. It's the role of the government and public health department to penetrate those issues and correct them as hard as they can. The measles outbreak was handled very well by the Department of Health in Rockland County. I'm sure long-lasting relationships have been made from that, and I assume that those are being utilized to our advantage in terms of reaching out to the various communities where we're seeing the outbreak grow and grow and grow. We have to get through to those populations a little bit better. Now, last thing I want to say about this is that the patients we see in the hospital today reflect transmission of the illness 7 to 10 to 12 days ago. I believe that the efforts to educate are working, and
Mhm.
because we're seeing a decline in the upward slope. Hopefully, we're seeing a plateauing. But we cannot assume that this is under control. We need to follow the guidelines and make sure that we do the social distancing, extreme social distancing, wearing a mask, assuming everybody in your house is safe and everybody outside of your house is potentially contagious.
There was a few questions that have come in here. Let's see. Uh, how long after you stop showing symptoms are you still contagious to others?
I think the gold
I,
standard
from
is,
from what you've been saying, I think I know the answer to that.
yeah, from the
What's
gold
that?
standard is you can you hear me okay?
I can,
I'm a little
yes.
bit choppy. Okay. So the gold standard, my understanding is that you have to test negative, meaning like you don't have a detectable viral load in your body, or you don't have a detectable nasal swab. Uh, Now, because of the need to get people out and working where they're most essential, we do have guidelines for healthcare personnel. Um, these are on these guidelines are on the New York State Department of Health website. In general, you need to be asymptomatic for 72 hours at a minimum. You still have to wear a mask until 14 days since the onset of your symptoms. The general thought process is that your body will clear this within about 14 days since the onset.
So, but you should be wearing a mask anyway.
If you have tested positive, not if you've assumed, because lots of people are assuming, oh yeah, I must have it because I don't feel well. If you've tested positive, you should still wear a mask until you clear the virus. And and we don't know if you're immune yet from future infection. So play it safe. Now, again, wearing a mask is not necessarily going to protect you from others. It's designed, the cloth mask is intended to prevent others from, contracting the droplets that you would, exhale or sneeze into the environment. That's the point of the cloth mask. If you are around, again, an infected individual, you need to wear a high level of protection, which is N95 at the least.
Yeah. So some questions have come in, and we've addressed some of them. One just came in about testing, and that's been something we've been talking about for weeks. Obviously, about the backlog. The question is, why does it take so long? What's going on with that? And I know you have a perspective from the hospital, so I know that on the state level, what's being worked on is the self-administering testing where someone can do it basically themselves, take a swab of their nasal cavity and be able to do the saliva test as well. And that's basically what's being worked on in terms around turning this around as quickly as possible. Do you have any input on that about where you see things, where how it's going, first of all, at the hospital, and then what you think in general about where we're going with testing?
All right. So from the emergency department, emergency medicine perspective, um, we will not test you unless we're admitting you to the hospital because the test results affect how we place you within the hospital, whether you're on isolation or not. People who have symptoms consistent with COVID-19 are initially placed on isolation by default and then removed if their test results are negative. We do not encourage people to come to the emergency department for testing. The reason for that is that if you are negative, you are entering an environment where you may pick it up just from the waiting room or walking into the hospital. Now, we do everything within our care that we can possibly do to protect everybody in the environment. Patients that come in must wear a mask. We limit visitors intentionally. It's horrible that we have to do it, but we're trying to contain this illness. If you come to the hospital for mild symptoms and you do not need to be admitted, we're not going to test you. Now, that does not necessarily make people feel better because they want to know. What I would say is, if you think you have the illness, then you should assume that you do and quarantine yourself from your family and friends. Wear a mask at home. Stay away from people who have chronic illness or that are older population. Okay? Call your doctor and ask for their recommendation on how to get outpatient testing. Now, that's based on what we've been doing for the last 2.5 weeks. This may change should we develop or receive rapid testing. Now, rapid testing is a quick turnaround, and there is a point to testing in the outpatient environment. For epidemiological purposes, we need to know where the cases are. We need to know where to deploy the resources and what to anticipate. There is totally a value, public health speaking, to knowing who is testing positive. But at the individual level, if you feel sick and you have an emergency, come to the hospital. If you do not have an emergency but you feel sick, assume that you are infected and quarantine yourself at home. And God forbid, if you were to get worse, we're here for you. But the importance of test results right now, we would like people to feel comfortable and comfort in knowing positive or negative. There is a what we call a false negative component to the test right now, which ranges between 15 and 30%. I might be wrong, but that's based on what I've learned so far, that we could tell you that you're negative and you still might be positive. So don't use a test to make decisions about yourself. If you feel ill, quarantine yourself. If you feel really ill, come to the hospital, but not for the test, for the treatment, for the help that we can give you.
Right.
All right. As far as into the future, when it comes to testing, I think really what we're going to have to work more on is antibody testing, getting that out to the public and to their doctors so that people will know that they've been exposed or not and how to behave. I lost your video there. Are you still there?
I'm here.
Are we back?
Can you hear me?
Okay, good.
Yeah, I'm here. Yeah. Okay.
People need to know if they've been infected because they need to know if they can go back to work and re-enter society. We want people to get back to work. We want people to be free Americans again. This is an awful time we're in, and we need a little bit longer.
We've got a bunch of questions that have coming in. And the question about ventilators. And the question is, what percentage of people that go on the ventilator recover? Did you hear that? The question was, what percentage of patients that go on the ventilator ultimately recover?
Okay. Can you hear me okay? Because it's a little bit choppy.
I can. Yes.
Okay. The ventilator, patients that require ventilator support are already very sick, and the chances of coming off the ventilator are very, very low. In the United States, the numbers that I've been reading about, once you're on a ventilator, and of course this depends on your age and previous medical history, the chances of coming off, I've heard numbers as good as 40%, but I think it's much, much lower than that. I think it's less than 20%. I don't want to paint a grim picture because there is a need for ventilators and people are getting off of them. I just think that it's imperative that the public understand that the real focus of our energy, well, of course, ventilators are important. I don't want to take away from that, but we need to focus on preventing this illness in the first place because the ventilator is a last resort. And unfortunately, as we learn more about this illness, we are realizing that the disease pathology is not consistent with anything we've seen in the past. We've assumed that it's a bad pneumonia. We've assumed that it creates acute respiratory distress syndrome. And that may be the correct assumption. However, we are not seeing people come off of the ventilator very easily, or they'll come off and then they'll wind up being reintubated and on the ventilator again. And it's a tragedy. I'm not trying to paint an absolute picture here. I am not an intensive care doctor. There are plenty of success stories out there, and we will always do whatever we can from the emergency department through the ICU, hospitalist medicine doctors, our consultants, will do everything for you. However, you need to understand that that if somebody's being placed on the ventilator, that it's a very important decision. This is the time, if it hasn't been in the past, for you to express your wishes with your loved ones. God forbid, should you unfortunately get infected, because they need to know what you would say if you don't have the ability to use your voice at that time. It's a horrible, painful situation to see somebody get sick. A family member does not want to ever see that. It's even more painful for them to all of a sudden imagine or try to come up with what you would want if you haven't had this conversation. I know it's uncomfortable, it's difficult. These are things that people should be talking about honestly before a pandemic like this. But we need to communicate with our family and loved ones what we would want, because it's really it's a crisis situation when you're in the hospital and in distress, and we want to make the right decision that you would want us to make on your behalf.
It makes a lot of sense. As much planning that we can do ahead of the curve, is just so important. It's one of the things that I've been working on a long time is organ donation, to make people conscious of the fact of thinking about, hey, if you make that decision and share that with your loved ones, the same is true with all end of life decisions, are just so important and make it easier for everyone else. And you never know. So it's important to have that conversation. With that, what is the hardest part of your job?
You're coming in a little choppy. You said, what is the hardest part of what? I can't hear the question. I'm sorry. Can you repeat the question?
Oh, what's the hard? Oh, what's the hard?
Question was, what's the hardest part of your job on a daily basis?
Okay. All right.
Okay. Hey.
Yeah. The hardest part is seeing something that I've never seen before. We're all really well trained to handle crisis. We're used to following patterns. That's how we can operate quickly. The hardest part is navigating an uncomfortable terrain and not having any sort of guidance or information that I can give to a family other than some 3-week-old statistics. Right now, the hardest part of my job, and probably for anybody who's practicing medicine today, is dealing with this COVID pandemic. Nobody can find something to compare this to. They think back, HIV was a terrible, terrible time. I was a young kid during that. It was extremely scary. But the people who worked during that, period of confusion, weren't necessarily terrified to go to work. They were, cautious. But right now, it's kind of like entering a war zone. I'm not trying to inflate our importance. We're not soldiers. We're healthcare personnel, and we train for crisis. But it's very difficult to deal with a crisis when we know so little.
Well, thank you. And hopefully my audio is coming through. I think my reception and my power is fading. But some things I wanted to mention before, if I lose you, I wanted to thank you for joining us here tonight, and your experience on the front lines, sharing that with us is so important. And I'd love to have you back on maybe next week so you can give us an update about what's happening. That would be fantastic. I wanted to make sure that all of our viewers know that now the health exchange has been open. There's open enrollment. so that if you don't have health insurance, you can go to the New York Health Exchange. That open enrollment is until May 15th. So that's an extremely important thing to do. My office, the phones have been ringing off the hook, particularly for unemployment insurance. And that is something that the Department of Labor, their phone lines have been constantly busy. And we're asking people, please call our office and we will try to help you with that. We know they're working with Google, that they're developing an interface that should make it much easier for people to apply for those unemployment benefits. The federal government passed legislation that now increases on top of New York's unemployment insurance, which is one of the most generous in the nation. Now they're adding a $600 per paycheck or per week on top of the New York State unemployment insurance. So we know that the lines have been busy, but please do call our office and we'll be happy to help you with that. And that's really what I want to make sure that everyone knows, that even though my physical office is closed, I still want everyone to call our phone number, which is 845-623-3627, or send me an email, carlucci@nysenate.gov. Go to our website, senatordavidcarlucci.com, or no, I'm sorry, it's senatorcarlucci.com, and the information is there. Make sure to call me so that we can be in touch and I can understand what the problems are that you're going through, and that's how we can fix the problem on a more global scale. So with that, Dr. Greenhut, do you have any closing remarks for us tonight?
Yeah, I have to thank my wife, Sharon. She's fantastic. She's been a superstar in taking care of my house and the kids and educating. And I'm sure every healthcare worker, every essential service person out there is so appreciative of the support that they get from their friends and loved ones at home. So I'm sure that they would all thank them publicly if they could. And also the community, this chant that happens once a week or twice a week in Rockland County, we hear you. We appreciate that. We thank you for the food and support and the moral encouragement. We need it. And we're going to get through this. We just all have to be responsible and keep supporting each other. Cannot turn against each other. Rely on the officials. They know what they're doing, and we're always there if you need to come to the hospital at Montefiore Nyack.
Well, Dr. Greenhut, thank you so much. And I know all of us want to thank you and all your entire team there at Nyack Hospital and throughout the system that are just putting themselves in harm's way to protect all of us. I think the greatest way that we can thank you is by helping work towards prevention so that we can practice social distancing. We can, by keeping all of ourselves safe, we're helping the community as a whole. So again, thank you so much for the work that you do. Thank you for joining us, and look forward to having you back very soon. And I'll work on the audio so we can communicate even clearer. So Dr. Greenhut, thank you for joining us. Appreciate it.
Thanks so much for all that you're doing.
Thank you, everyone.